And here is your question.
A 24 years old man present to acute emergency after attending head injury during car collapse. You notice the patient is bleeding profusely from a scalp and deteriorating his GCS. You prepare him for surgery and have revised surgical anatomy of the region. Okay. Of surgical anatomy.
Right now, so if you have read and understood, considering this surgical anatomy station, kindly tell me, what are you looking at? What is this?
This is the inner surface of the base of the skull, show anterior, middle, and posterior cranial fossa.
Good, very good. Okay, can you please identify what this 11 is?
It is 11 is foramen magnum.
What are the structures which pass through it?
Passes arteries, vertebral artery, anterior spinal artery, posterior spinal artery, and lower part of the medulla and spinal part of the accessory nerve and tentorial membrane.
Yes.
And tubal, and that's it.
Apical ligament of Dens.
Yes,
well.
apical ligament. Okay.
Yes. Okay, right. Can you please tell me the boundaries of the middle? How many cranial fossas are there?
There is 3 cranial fossa: anterior cranial fossa, middle cranial fossa, and posterior cranial
Very
fossa.
good. Can you please tell me the boundaries of middle cranial fossa, please?
Middle cranial fossa bounded anteriorly by the laser wings of the sphenoid bone. Yes. And anterior clinoid process, and laterally by the isthmus part of the temporal bone, and posteriorly by the petrous part of the temporal bone.
Okay, and the floor is formed by?
Isthmus part of the temporal bone.
Body, yes, body and the
body of the
sphenoid. Okay, can you please identify what this 42 is?
It is a supraorbital fissure. This line is 42. Good.
Right. Can you please identify this 46?
Yeah, foramen lacerum 46.
Can you please tell me what are the structures which pass through it?
Foramen lacerum.
Yeah, foramen, yeah. Venous foramen.
Foramen lacerum is filled with fibrocartilage, and in superior part, above the superior part, the internal carotid artery pass through it.
Okay, can you please identify number 12?
Number 12 is foramen ovale.
Yes, can you name the structures which pass through it?
Foramen ovale passes optic ganglia, the third part of the trigeminal nerve, like a mandibular nerve, accessory meningeal artery, lateral petrosal nerve, and emissary vein.
Lesser superficial petrosal nerve, yes, and emissary veins. Okay, can you also please identify? Right, which one? What is this one? You told me 24.
24 is for middle meningeal artery, a group of middle meningeal artery.
All right, okay, right. Groove. Why does it leave a groove? This groove represents what on the outside of the skull?
The roof is depression of pterion.
Pterion, okay. How is pterion formed? Very good.
Pterion is formed by 4 bones: parietal bone, temporal bone,
Yes.
part of frontal bone, and also sphenoid bone.
Okay, right. Can you please tell me if there are lesions on the skull? So what would be the causes that you'll think of? And what kind of lesions can be seen on the skull?
If any lesion here causes subdural hematoma due to injury of the middle meningeal artery.
Yes, but then there are sometimes cancer metastasizes and causes lytic lesions of skull. Can you name few conditions which cause lytic lesions of skull?
Lytic skeletal metastasis, hemangioma, osteomyelitis, sarcoidosis, Paget disease, and multiple myeloma.
Okay, good. Can you please tell me what is the type of growth plate in clevis?
In clevis, there is a spheno-occipital synchondrosis.
Yes, there is fusion, but the type of growth plate is hyaline cartilage. Can you tell me about the fusion of spheno-occipital synchondrosis? At what age group it takes place?
It in female 12 to 13 and in male around 15.
Yeah, around 15 and completes around 17 to 18. Okay.
Yes.
Can you please quickly tell me the boundaries of posterior cranial fossa?
Boundary of posterior cranial fossa, anteriorly the angle of the petrous part of the temporal bone, and posteriorly by the occipital bone, and laterally by the isthmus and petrous part of the temporal bone.
And the floor is?
Floor is formed by the occipital bone and part of the body of the sphenoid bone.
Yeah, mastoid part of the temporal bone. And
yes, also mastoid.
Mastoid, yeah. Okay. What part of brain is contained or carried by the posterior cranial fossa?
Sorry, ma'am, I cannot hear.
Yes. What part of the brain is carried by the posterior cranial fossa?
Posterior cranial fossa contain the occipital lobe and occipital lobe of the brain, and also the cerebral tonsil, cerebellum.
Brainstem and cerebellum.
Brain.
Yes.
Yeah,
okay. Can you please tell me what is clevis?
Clevis is it's a junction. Clevis. It is junction between a sphenoid bone and occipital bone.
Okay, what is the cranial nerve tract on the clevis?
Clevis, abducent nerve passes through it.
Very good. Okay, what is the name of the juvenile structure that forms the clevis?
It's formed by the body of the sphenoid bone.
Spheno-occipital, yeah.
No, sphenoid.
Okay, lateral, right. How would you diagnose if there is a fracture of the base of the skull?
I'll diagnosis by CT scan.
Okay. How would the patient present? What would be the
patient present with nasal discharge from CSF rhinorrhea, also discharge from ear, vomiting.
Yes. Okay, one last question. Can you please name few benign tumors which arise from posterior cranial fossa?
Okay, it is acoustic neuroma, then hemangioblastoma, ependydioma, ependioblastoma.
Very good. Good. Thank you.
Okay, thank you, ma'am.
Thank you. Good. Started your timer, and here is your question. Right. So if you have read and understood, considering this communication skills station, kindly begin.
Hello, I'm Dr. Muhammad, one of the surgical doctors. I'm so sorry that you have been waiting so long to see Mr. Man.
Yes,
Can you have a seat, please?
Yes, I'm waiting for my report with a report, and I've been asked that my husband need a CT scan.
Yeah, I'm very sorry to tell you that Mr. Man is unable to meet you for today. He has been called out for an emergency situation. So I'm here to help you and talk to you about what can I help you.
So
I'm
not getting you. Are you not Mr. Man? I want to talk with Mr.
No.
Man.
Actually, I'm not Mr. Man. I'm sorry to tell you that Mr. Man has been called out for an emergency situation, so he is unable to meet you at the moment. But I can arrange another appointment to meet him. I will sure tell him that you were here. I'm here just to help you and tell you what I can do for you. I know that your husband has been admitted a few days ago, and he's complaining of abdominal pain and was calling for a few weeks ago. And he has been asked to do some CT scan. Unfortunately, the CT machine is not working at our hospital at the moment. I'm really so sorry to hear for that.
Why CT is required? I'm not understanding you properly. Why my husband suddenly needs CT scan?
Good.
Okay. CT has been ordered just you know that your husband has abdominal pain and swelling. This swelling is due to fluid accumulation in his stomach. And our first investigation revealed that he has this fluid contains some cancer cells. And also, in order to know what is the origin of that cancer and to know how much does it spread, we need to do this.
So are you telling, I'm very anxious, doctor, that my husband is, are you sure that my husband is having cancer? Is there no any alternative?
Actually, it is very early to tell you that, but our first investigation revealed that this fluid contains cancer cells. In order to answer your questions, I need to do some real investigation to know what's the origin of this cell and how much to spread and the options treatment.
Okay, why don't you transfer him to the big hospital? I guess your hospital is small. Why didn't you transfer it from the start?
I understand your obligation towards it. Maybe that our hospital is small, but usually we do all the required investigation within 2 weeks. But unfortunately, the machine is not working now, so we might consider to do some alternative of the CT scan, just ultrasound or MRI, or in the worst case scenario, he might transfer your husband to another hospital.
So do you think, is it a cancer? Do you think he will need a surgery? I'm very much worried now because I want to speak with Dr. Mann. I'm not satisfied with your presentation. I want clear explanation.
I apologize for that. In order to actually, your husband has been shown that this fluid collection in his stomach is contain cancer cells. This is give us clue that he might have advanced cancer. Actually, we are not doing such operations for in such case. We will not put your husband in pain and suffer with a little benefit.
But doctor, you have to understand, but he could not breathe well right now. I'm worried that he might die soon because he cannot breathe and no one can alive without breathing.
Yeah, this is usually due to accumulation of the fluid in his stomach, which prevents distension of his blood, so he might not breathe. But we can withdraw some fluid from his stomach to reduce the amount of fluid inside the stomach, and also we can prescribe some medication which prevents or reduce the amount of fluid in his stomach, of course. But we need to tell Mr. Mann about that.
Should I need to consult with my other relatives? Because I'm very much concerned with now. He has a brother and he is right now traveling. Should I tell him and should I inform my other relatives too?
My advice is try to wait for the results as it is early to tell you that.
Okay, but I'm very much worried right now about my situation of my husband. Please do something quickly for the betterment of him.
Of course, we are here to serve you, support you, and give you everything help. If you have any inquiries, don't hesitate to contact me. Okay, I will leave my phone number with the nurse. So before we end it, can summarize what we have been through?
Okay.
Your husband has admitted with swelling pain and his stomach, and our initial investigation reveals that he has some fluid collection in his stomach, and also explained to you that another alternative because the CT machine is not working in our hospital. Thank you for understanding.
Okay, thank you. Sorry, but please arrange a consultation with Dr. Mann as soon as possible. Thank you.
Okay. So can you give feedback now? How did you find communicating with Dr. Mohammed as your contact?